What's up, everybody? My name is Walter Hinchman. I'm the CEO and co-founder of Swolverine. Today, we're going to be talking about the specific topic of gynecomastia or bodybuilding gyno. We're going to talk about what it is, why it's common in bodybuilders, and how to avoid it the best as possible as you can. So, gear, right? Guys who are taking gear, aka anabolic steroids, right? That can lead to a medical condition called gynecomastia or bodybuilding gyno for short. Anabolic steroids are commonly used and relied upon in sport for bodybuilding to be competitive, to maximize muscle growth and size. So we're going to talk about what gynecomastia is, how to avoid it, and what to really look for when you're competing in bodybuilding. So first off, what is gynecomastia or gyno? Gynecomastia is defined as the development of tissue in the male anatomy beneath the breast or your pecs, right? Gynecomastia is often caused by an imbalance of testosterone and estrogen hormones. Symptoms of gyno are often not life-threatening, but only really cosmetic. So it's not like the best thing to look at, right? Especially if you're competing in bodybuilding as a bodybuilder or in that specific modality. So what happens that symptoms of gynecomastia can include puffy, enlarged, swollen areas around the breast or under the nipple. So depending on the severity, depending on the progression, gyno may require surgery if the condition persists. But really, the number one way to get rid of gyno, or if you see gyno is forming or developing, is to cease the use of anabolic steroids. Now, if you're doing bodybuilding, that can be hard, but you might want to reconsider what you're doing. So the next question is, is gynecomastia common in bodybuilders? It's really difficult to determine the exact number of cases of gynecomastia and how common it really is. There is some published data on it, but it is experienced by a wide range of bodybuilders. A study published in the Journal of Plastic and Reconstructive Surgery found between the years of 1980 and 2013, almost 1,600 bodybuilders were treated surgically for gynecomastia. Additional research suggests that at least 30% of all males will be affected by bodybuilding gyno at some point in their life if they continue the use of anabolic steroids persistently. Testosterone is one of the most commonly used anabolic agents in bodybuilding. To clarify, testosterone itself, and if you're listening to this or watching this, right, it's not really the problem. It's really the misuse of testosterone and anabolic hormones, which really leads to the problems and which can lead to bodybuilding gyno. When injecting testosterone, a portion of testosterone is converted into estrogen by your body by an enzyme called aromatase. So when the body senses that there's too much testosterone, then it actively tries to reduce that amount of testosterone through a process called aromatization. So many bodybuilders will really pair injecting testosterone or injectable synthetic testosterone with an aromatase inhibitor or estrogen blocker to offset that imbalance of estrogen and testosterone when injecting testosterone subcutaneously. So aromatase inhibitors can increase your testosterone or your overall levels of testosterone along with other hormones by inhibiting the ability of estrogen to be converted to estradiol or estradiol in the body. So this decreases the overall level of estrogen in the entire body, and it will really help out with reducing the symptoms or negating the ability to develop bodybuilding gyno. So that really gets us into our next topic, and is how to treat gynecomastia. So obviously, the recommended treatment, number one, is to completely cease the use of anabolic steroids completely. If you treat it in the early stages, development of gyno can be reversed. However, depending on the severity and the duration of the symptoms, surgery may be definitely in your future and be required. Surgical treatment for this entity is really a combination of liposuction and a direct excision of the affected area, so extirpating that tissue that develops underneath the nipple area or by the breast. So there are supplements that can reduce, the onset of that. You can use DIM. DIM is really known to work as a natural aromatase inhibitor. That's probably the only herbal supplement that would really help with that with gyno. So overall, there's really no way to avoid it. If you feel like if you're going to be a bodybuilder, if you're going to compete in bodybuilding, it's a condition that can happen with a misuse of testosterone, with the misuse of anabolic steroids, when there is an imbalance between estrogen and testosterone production. As you age, those testosterone levels will naturally decrease, and with an increase in estrogen. So it's really hard, right, to reverse the symptoms of gyno when you have it. So you might have to seek surgical intervention to treat it. But it is not life-threatening. It's mainly cosmetic. So overall, it's not going to affect your life in any way or threaten your life in any way besides cosmetically, and it's not going to be the greatest thing to look at, or it's not going to be the greatest thing for your confidence. So anyway, if you need any more information on anything related to health, wellness, supplements, fitness, whatever it may be, get on the website at swoleverine.com, check out the blog, subscribe to this YouTube channel here, and until next time, guys.